They said I'm nothing, yeah. They said I've got nothing to offer. They said there's no hope for me. Oh, just because I'm living with disability does not mean I can do nothing. Disability is a thing of the mind, so don't look down on me. There is ability in disability. Give me a chance to show you there is ability in disability. Give me some space to prove it. The fact that I'm living with one form of disability or the other does not make me less human from others. I can be the president, not only a resident here. So give me a chance to show you I can be a governor, I can be the senator, hey. So give me some space to prove it. I can be a doctor, I can be a pastor, yeah. But give me a chance to show you I can be a teacher, I can be a preacher, hey. So give me some space to prove it. There is ability in disability. Give me a chance to show you there is ability in disability. Give me some space to prove it. There is ability in disability. Give me a chance to show you there is ability in disability. But give me some space to prove it. Oh. Ability, disability. Oh, just give me a space, give me a space to prove it. They said I'm nothing, yeah. They said I've got nothing to offer. They said there's no hope for me. Oh, just because I'm living with disability does not mean I can do nothing. Disability is a thing of the mind, so don't look down on me. There is ability in disability. Give me a chance to show you there is ability in disability. Give me some space to prove it. The fact that I'm living with one form of disability or the other does not make me less human from others. I can be the president, not only a resident here. So give me a chance to show you I can be a governor.
Hello, my people. Good afternoon. Today na another Saturday. The last Saturday don't come for this month where we say na question and answer. Today the house full well. Na say so laugh now they laugh because I happy well because one of our guests we know they come since he come today and he make my belly sweet well. So I sure I don't know me well, but I will tell you now my name for those who just join us today. My name now Mrs. Modupe Afiz Ogun. Now me be CEO founder of Beautiful Hands Foundation. Beautiful Hands Foundation, I get this podcast program, so Ability Inside Disability, where we for they talk about learning and intellectual developmental condition, where they affect our children, affect adults, constantly affect our family, because anything where they bother our children, our family member, now everybody now in the border. And it not stop for them, now waiting still they affect society. So what would they talk for this program? Now for us to first understand what these conditions be. Then we will come to talk about solution where we fit bring to reduce all of the challenge where they follow all the different conditions. Plus, sometimes talk about the things where we go fit do to even prevent some. If you now remember, we talk about malaria. Malaria, that one na to prevent them as much as we fit. We talk about alcohol. That one na to run from them. No reason for anybody to drink alcohol when he get belly. And the man too, say you won't give person belly, not drink alcohol. So, not be only me the studio as soon as I know. So I will start with Mr. Sam.
My people, now well done. Happy weekend. It suits me for God. Say we don't gather again to discuss matters we affect people for our community where they live with special needs, where they live with disabilities. So I hope so now don't gather on our questions for our discussion today. And I will hear from us shortly, All right.
The next person will go greet you now our very own Dr. Bako.
My people, now good afternoon. And it's up, I say don't do 2 weeks, I never did here. So. Remember the thing on the hungry me.
I say
now don't come back, but
we're going to put a cup for here. What we do they collect fine. Anybody will not come and go pay.
Really, it's nice to be here again. I happy say una day together with us, and I believe say una don't get all of una question to talk about all of the learning disabilities. So don't they talk about attention, hyperactivity disorders, the autisms, them, how malaria they affects learning and the likes. I believe say as they bring the question, man, no worry. Plenty people they ground enough to at least make clarity, make us understand most of these things. Thank you very much for being around.
Then the next guest will go greet us now, Dr. Guntap. Dr. Guntap fine. Now he go big pass. But now holiday period now we never start to the collector. After today, I go put one cup for here. Anybody will not come, he go pay. Me, I like money well. Dr. Guntap.
Good afternoon. I need the runaway. Like somebody will talk say, everywhere runs stew.
Then another of our brother will be here with us. I don't know how well because he follow this, help us understand discussion last week Saturday for waiting how to help our children for house to stay improve how to learn. Oga Boniface. I will greet our people.
Okay, my people, welcome. I want to greet you now. Like I said last week, we can try and invite person, and I know still I don't call person, make him come join now they hear with him now they hear. So when they welcome all our questions, we take ground, we go answer them like everybody don't talk. Welcome.
Now do well. I have seen the studio full. We talked last week. Say we go put account number. I forget. Let's say they pray. When I pray, answer. I cannot put account number. I no go forget for next week. So make una start to dey send una question o. Opportunity don open now. Anybody wey get question, una dey send am to the WhatsApp number for the. Okay, make una dey leave am for the Facebook comment there. We go dey answer am as they dey come. So the ones wey don dey with me for here, make we start with this one now. The question say, some children, they write 7 and 9. They know they write am well. They go write the 9 like 6. Some go write the 7. They go write am like say opposite side instead of this side. Say, wetin you fit do to take fix this kind condition? Oga Sam, you go start. Oga Boniface, you go finish. Because now 12 now the special education is still get for here.
Okay, that thing where you just mentioned now, you say they call mirroring, and it is inside one of the presentations of condition where they call dyslexia.
Okay.
It affects children ability to take, understand, written words, and even how to take write their own when it reach time.
Yes.
So you see, say some of these alphabets when talk now, or the numbers, they look alike. If you see 9 and 6, just turn them upside down and the same thing.
Not the same thing.
Then self they follow mix up P and B.
Yes.
Then M and W.
Yeah.
So these are some of the common presentations. So at this point, if you want to teach Pekin how to overcome those kind of challenges, he gets different strategies. Okay, for instance, make I give example with waiting. I just worked with one boy recently. The boy not 10, but he still they mix the B and D. So the strategy will come is to say, you see your right hand and your left hand.
Yes.
The same way why our teachers still teach us greater than less than. Your right hand like this will be greater, then this one will be less than. By the time you do it like this, if the thing they confuse you when you do like this, you go feel understand which one will be greater, which one will be less than. The same thing way they happen with people who know two sabi where their left hand and their right hand. Maybe say if you ask her where is your right hand, you go need calculate first.
Yeah.
This right.
Yeah.
So what we can do is say for B, we use right hand now. Take shape like this.
Okay.
We don't make circle there, carry one for up. You see, say the thing face this side.
Okay.
Then D, the same thing. So now the strategy will teach the boy say, okay, if they confused, if you don't know which one it be, keep your hands like this. At least you will know say the one way from your right hand now. B, this other one now D. So that's 7 and or 6 and 9 rather where the picking they turn upside down. You go gamify them. Okay, like the 9. You go feel put cap on top the 9.
Okay.
As they write down number 9 now, and you come put cap, if you come put small eye, the picking now go don't associate
that eye.
The shape we stand, the wear cap get eye. Now 9 will be that. Then the 6.
Enough wear cap.
You
wear pampers for
No, but now some of the strategies we they use this.
Yeah, I agree with you.
Make the thing stick with the
yes.
children. Then you get one strategy where I learned. I think that was around 2018. So for the alphabets, maybe W, M, where they no fee grab now, we will try use that alphabet to draw something.
Okay.
Use colored markers. So for instance, if now M and W on top the M now, if you find maybe in friend name or something, then design hair on top the M with color. Then the W you go put like grass under.
Okay. Just like that you put grass under.
So those associations will help the picking tell the difference between the both when in one writer. Because most times the problem no they do when they won't read them. Now when they want
write
down,
maybe the problem. Okay. Me, I can't get one question now. Continuous prompt for an extended duration. Go for help?
It dey help for milder cases. But for some children, it dey take more than they go need make that what do they call it now? Visual memory. They go need associate them to something.
Okay. And my people, what is the meaning of waiting? The question when I ask, they say, you know, some children they when they start to learn how to write, you go hold your hand.
Yeah.
Now that one I be prompt where we talk for last week. You know, say we explain. Now, no say we explain prompt as help.
Yes.
to assist the pikin. You no go just leave am, because sometimes they go come frustrate, they go dey cry, dey vex, because they no know how they want to do am by themselves. But if you help them start am, after they go dey used to am, you no go need to dey support them again. That support now, as we talk last week, now they call prompt. So the question wey may I ask Oga Sam just now be say, what if you dey hold the pikin hand, make it take dey write these numbers wey we talk, so you take and write the 6 correct, you take and write the 9 correct for some, you give yourself maybe like 1 month or 2 months. The answer wetin you talk be say na good idea, but not be idea wey go work for all pikin, because wetin make the first answer wey he give, because the first answer wey he give be say we go put something on top of the different shape, the different pattern, to differentiate am from the pikin. He say 9 stand, you go put a cap on top of 9, because na wetin stand na you go fit hold cap. Then for that 6, you fit leave am, or you go put grass, because grass na ground na e dey, so the 6 sit down. Because the pikin go dey remember that grass, he go remember 6, he go remember to write 6. The pikin go remember cap, he go remember to write the 9 correctly. So wetin he talk now be say the reason why the one when I talk just now, that prompt, why e no go fit work for all pikin be say, not be all go quick remember am like that all the time. If you don't know, they help am again. But with that sign, most pikin they go remember am. So now wey you be teacher for inside this, our people, our listeners, may una write this example down. Plus parents too, make una write this example. Just put mark the thing where you know say if the pikin like orange well, if he put orange on top of 9, if he put orange on top of 9, then maybe the thing where you not like, put am under 6. You not gonna forget, because you don't like her. You don't like her. So now 4 things they teach am now. They teach am 9, teach am orange, teach am 6, teach am the other one. Abi? At the end of the day. Yes. So that's another example when I use what you answer now, take give now. Oga Boniface, you get anything where you go add? Okay. You don't let me ask.
Just add small.
There plenty.
You get one
Okay.
technique wey
Okay.
they use for children who get challenges with some kind of sounds, producing some kind of sound.
Yeah.
They difficult for them. They use visual cues, that is our facial cues, and sign language as well. So if they associate some of these things with visual cues, like for instance, if we want to produce one sound, we go, for instance, if they do na B where I want to produce, and they use my for my field, try to see how I will help this pattern now. So if they try to produce that kind of B sound, they close our mouths, as in they show them say they suppose hold their lips together, can't release air all at once. You understand? So that particular sign they add to everything, they help them. Like we think talk associations.
Okay.
But get one technique where been used for person before. Maybe say they get problem with B and D. So I tell them say B they face like this, and D they face like this. You understand? So imagine say this now the straight line. B go face like this. Immediately, in the face book, now like that thing will write down. You understand? So
Go write B like this.
Remember, B they face like this, you go
So
write
we
down.
just go.
D they face like this, you go write down. If na 6 and 9 as it talk, 9 they stand up, they face up, 6 they go down. So some of these bodily cues help if you associate.
Okay. Okay, ask question.
A question. What is the calligraphy they help?
Oga Sam, calligraphy.
To teach handwriting and how to draw the. It dey help. Now, the issue with dyslexia now. Now say no, we say the child no wan learn.
Na the way the brain take read am. Na the way the brain take read am.
Interpret that thing now. So you will need add something on top. Maybe dramatize, just add and small animation. You see, nowadays, all these people for the other side of the world, they don't really move into gamified learning. So if you see apps where children they take learn now, everything they be like saying play something, but it is stick for children brain because colors they inside them. fun characters, things where fun is small, they inside. So even the learning ways of
It will make them grasp better.
Exactly.
Okay, Oga Boniface, now you get this question. So what is the difference between speech therapy and sign language? Quickly. They say our question plenty.
Okay, say speech therapy, na a technique, body of techniques wey they use, they address speech problems. They address very tangible speech problems. Whereas sign language, although you follow for the total communication approach, but sign language they specific for people who get challenges with hearing. Say for speech to be possible, person suppose they hear. Speech they start from
Hearing, yes, from oral, yes.
Now waiting the pikin hear, na him
Go talk, yes.
You understand? So the speech therapy they easy if hearing problems do they attack. In fact, if I do assessment, I dey first ask this child you don't do a audiological test, get any hearing challenge. Because if that child get hearing challenge, no matter what I do with them, it will be complicated. So speech therapy they handle speech problems, language problems and speech problems they associated. Whereas sign language, we feel use sign language as a technique for speech therapy.
Okay.
They use sign language as a technique, especially for person who don't suffer from stroke and person who be say yes they hear but they no sabi use speech.
Yes.
You understand?
Yes.
Yet as a means of using that total communication approach, you fit add that speech therapy, that sign language. But sign language now specifically for people who get challenge with hearing.
Okay, which means but Mr. Sam, if you put on like that now, say sign language now specifically for people who get challenge with hearing, but I know say sign language is beneficial for children who get autism and they be non-verbal, because the reason where children will get condition like autism and we not fit talk when their speech not develop, one of the reasons why they get massive behavior issues now because they not fit communicate. So instead of you to just leave the pikin like that, the pikin gets you train now with sign language. That one go relieve tension because he get an outlet.
You get what Oga Boniface talk. Suits me, self. He follow join this thing where you talk about now. Because he say while speech therapy different from sign language, but them they follow use speech therapy sometimes, sign language sometimes inside their own speech therapy now. We cut across board. So even they see pikin we get autism, maybe the pikin they non-verbal, and don't try the different strategies to take help the child make he begin to produce speech sounds. They talk the child. Then maybe he try text pictures so the thing no work. Instead go need.
So in that case now, sign language not be for only person we know the hear.
Exactly.
That one now they go because you know what me don't understand for this disability community be say, the one thing not be only one thing. You understand? Person way they blind if he get hearing impairment. Person will get hearing impairment if he get autism. Person will get autism if he know if he talk. PECs if he no work for her.
Yes.
So if you call the environment where that conviction in your head say speech language now for only person we know they hear, the person will get autism not go even get chance to get tool to fit communicate. You understand? Now there, now I want.
Everything I talk, I see now this sign language they part of the total communication approach. We be say if you as a speech therapist, or if you want to learn that area, you go that area, you supposed to know all the various techniques. We be say you go help person communicate.
Okay. Communicate
through any means possible. So, but waiting I talk, we say you see sign language, now technique where they use specifically for these people. They target once they notice say you get hearing problem. The first thing we will come their mind.
Sign language, okay.
But not be say they restrict
to
only them.
I just want to make sure say we
Clarity.
get that clarity, because everybody they understand things differently.
Yes.
Because when you talk that specific, something go for my head say, well, specific now only for these people, but no. Okay, the doctors, Anybody, any of our doctors, we answer this one.
Also don't come.
They say whether autism, if you diagnose autism before birth, is that possible?
Oh, my people. So as a matter of fact, that question, Shana, a very complex one. Oftentimes they're not, yes. And we go feel say no. Because most of them are neurodevelopmental problems. Yes, some of those neurodevelopmental problems, like when we talk about the causes of autism, we know say then they plenty. Like causes of other things like ADHD, then they plenty. And we know say most of the problem they happen during pregnancy, from a genetic thing, one of the first causes. Let's say, okay, the person come down with autism, genetic components there inside. And for advanced world, Western world, they fit do what they call amniocentesis. Right from when mama picking the belly, they fit just take that fluid and they get certain antigens and certain genetic markers where they fit just fit check inside the person, the mama belly. Where go fit make them know say, maybe this picking because in the feed give out this as one of the byproducts because normal picking the belly, he mind the pee, you understand? So then they incite that fluid where they inside where the picking they stay. So they always use that one, do some genetic mapping, and you go understand so that this picking will come down with something. Then some of them again, now only when they come out. When they come out again, okay, in the event of pregnancy, labor, and delivery, here we feel get predictors to say this picking fi get problem. We feel get predictors to say this picking fi get problem. Okay, let's say the woman do labor for too long a time, then come born picking, maybe the picking no start breathe, no cry quick and stuff like that. So those ones you should say the picking don't even start get problem already inside the brain, and any picking born earlier than normal time. It means that because it gets a particular lifespan and development was supposed to happen inside mama belly.
Yes.
That means say even if woman reach 40 weeks at a particular time, born say the gas inducer because say this time something correct. Say at this particular time, this picking day inside belly is supposed to don't come out. And again, I make if they come born earlier again, that means some of them not just even abnormal behavioral problem. So there's a kidney never even finish develop very well, brain never finish develop very well. One picking at say okay 28 weeks, even 30 weeks, 35 weeks, he never reach time yet. So all of those ones we get problem when did they grow with time. I mean, if doctor see person they get some abnormality, go start ask all those history to the time when the mama born the pikin, at what gestation, how many months the pikin dey inside belly when they born them, during that delivery, any complication, any prolonged labor, or when they born the pikin cry when it's supposed to cry, or maybe it take long time with resuscitation. We need event of that time, oxygen they go to the brain, and we know say when it comes to neurodevelopment, now the brain be the problem, and it means that time when they born the pikin means oxygen don't enter the pikin brain at that particular time well. The pikin they breathe well, you don't even cry and stuff like that. So you say something don't happen inside. And then they born you earlier self, the brain never finished develop yet in utero. So that one again, then subsequently when the pikin can they grow. And we know so those ones say if it happens, even when mama get belly, maybe she get one infection, urinary tract infection, even malaria or the rest, that one another problem. So when the pikin come the outside again, the malaria, which is one of those topics we'll talk about, which we talk plenty how it even carry affect those small blood vessels for inside brain. On the own, it will affect the pikin. Apart from the fact say that one will prevent the pikin to go school well, and painfully malaria and something a day and environment and it is very frequent. Like last week, I even managed my pikin with malaria. So it's a very common thing. So also as the pikin they grow, maybe any other infection also superimpose the problem. If the pikin has sickle, which is a genetic problem, if he still superimpose the problem. So within that developmental area, another time I'll come to find Boniface and Sama, so I'm going to add on our own knowledge to this one. Diagnosis begin with me with certain parameters when I use carry judge this guy. Apart from the clinical one, we also go do, then we'll send them to them so that they will see how they will help this begin. So from when the mama de belly, the process of delivery will give us predictors to whether this pikin will get problems subsequently, and even during that first 5 years when the pikin they grow, what are the things that happen within his development? It will still give us idea whether something will come. So then when we consider the behavioral abnormality and at least attaining milestone, just like he made for class or even for the environment, again will give us idea about we fit and we know if it depending on what thing they cause the problem.
The situation. Dr. Bako, hi. Thank you so much. That's good you carry us, go come back. Dr. Gunther, the question now, if pikin too they run up and down, it means say the pikin get ADHD.
As they try to me talk about ADHD.
Possibly. Because ADHD are just attention deficit hyperactivity disorder. So if it is possible, say yes, the person, the pikin get her. Now why they run around? But not be every running around. Be
just the state sense,
because
yeah.
you get some other things where you guys join before you go talk. Say yes,
This person
get ADHD. Maybe just running around because picking generally they difficult for them to start
get action.
from
Yes.
one place. Then they hyper,
Active.
and then their activity they different.
Yeah.
But it they affect their learning.
Yes.
It they occur for more than one environment or not just
School,
one
home,
environment.
church,
See,
and
they have-
mosques.
if
Yes.
they happen for school, they happen for house, they happen carry and go environment where you don't know. It's still there. Aha.
Either affect
Say
normal
you don't-
life.
Make we go check am.
Problem.
Let them go-
We'll check wetin dey
go
happen.
check am. But if you carry and go place where you don't know, you can sit down quiet. Then no be
ADHD.
The environment where you can see him and he's there.
You know, saying.
They run that one.
No be problem. Oga Sam, you want fly enter inside this matter?
As if they talk like
No, because na sweet your belle na make you dey do as you dey do.
no, see, you get within, okay, nowadays, awareness of autism don't they come out by God's grace. So now, anybody where person sees say they behave differently, this one.
You get autism.
They go see pikin, maybe pikin get joy, or maybe don't get sugar rush. Maybe
Sugar
they
rush.
get ADHD. So we now, as special educators
Yeah,
and professionals,
professionals.
we dey warn against labeling.
Yeah, labeling.
Go do diagnosis finish.
Finish
First
So
things
even
first.
me, I don't see all the classical presentations finish. I no go still open mouth tell you say you're picking
Get
until
anything.
you go through the
Diagnosis
diagnostic
process,
process.
yeah.
Then they call certify and say, okay, get this condition. But meanwhile, even when we never collect the diagnosis yet,
Yeah.
we fit
Start
to
do
dey support
something,
the
yes.
pikin.
Yeah,
Get the
exactly. So my people now here waiting Dr. Bako and Dr. Gunther and Oga Sam talk. Dr. Bako say when it comes to autism, yes, everything will happen around the pikin. And mama, we dey know wetin dey happen to our body and our pikin. We dey know because we dey get the signs. So anything we dey outside normal, wey happen to our pikin while the pikin still dey belle, as we take dey give birth to am, when we just give birth to am finish, the signs wey we see, especially between that age 0 to 5, all of these things dey important for us to observe, because na all of those things will help us know wetin dey really dey go on for our pikin life. So the answer to that question be say e possible make you know, but at the end of the day you must make thorough observation before you reach any conclusion.
Yes.
Make we no just carry judge like decide like that. No, the first work we will get be say make we dey watch our body, know wetin go on all the time wey that pikin take dey belle till we come born am, as e take dey grow. When we put all of these things together, then we will call go hospital. If we no dey comfortable, doctor see everything. No, from there they go tell us wetin dey happen to our pikin. Dr. Gunther and Oga Sam say ADHD no be say because say pikin dey run around. Yes, pikin overrun pass as e suppose run for the age wey e dey, fit be wetin you go say why this pikin dey do like this. But then you will come make sure say this pikin not be only when you papa and mama dey around e dey do am, because na happy e dey happy, e wan play. Or not be only when e dey with other family members, because e dey familiar with them. But if e dey overrun like that for house, overrun like that for school, overrun like that for church, overrun like that for mosque, overrun like that for even where you no know, okay, now problem don happen. Because if e dey overrun like that for school, which means e dey disturb himself, e dey disturb teacher, e dey disturb other children for class, school go complain. If you don't reach that level, you need to go see neurologist, a psychiatrist, a psychologist. They go assess your pikin. They go let you know wetin dey happen to your pikin. So at the end of the day, it still come down to observation. So the next question now. The next question say, if you take agbo and do correct prayer, Down syndrome go clear.
So okay. What do you question? What do you question?
He say if you drink agbo, you drink agbo, and you do correct prayers. Which prayer are not correct? Down syndrome go. First of all, make I answer this one. First of all, if they get belle, not drink agbo anyhow. Because na pikin you put for belle. Okay, now this question be say the pikin don already come out. You don't know say na Down syndrome you get. No be you go drink the agbo now. Now the pikin now you want give the agbo. Even if you give the pikin the agbo, Down syndrome no go clear. Why e no go clear? The reason why the pikin get Down syndrome now because in chromosome 21 divide into 2. Or it divide partially. It divide. It not stay exactly as it's supposed to stay. All of us as we did here so for this world, as long as we be human beings, our papa give us 23 chromosomes, our mama give us 23, making 46. Everybody will get Down syndrome. They get 47 chromosomes, which means their chromosome don't take one pass 46. How you want to take agbo take clear that one? Agbo no go fit clear that one. And prayer no go fit. It don't come. It don't come. So what it happen be say the fastest way to fit solve the problem be say make you accept them. And by the way, children with Down syndrome, as we dey talk for this our show, once you start to dey follow children, your pikin, your family member, we get this condition, you start to dey follow them from when they're small. Many things go improve. If you no go finish, but it go improve. Even us, we dey here, so we dey talk, we dey laugh, but we're not perfect. Every day now we dey work on ourselves. And that's why we go work on ourselves till we go die. Because nobody God creates 100%. The thing we need to do now to focus on how to take help the pikin. Instead of waiting, look, where would they find solution we will go use now. Because even the children who they not get Down syndrome, where would they raise? They to get their own problem now. And sometimes we go to pray that prayer, go be like say God no dey there. And we go to pray and we go to run around, we go to borrow money, we go to do all. Why? We believe say if we do all of this effort, God go because of our answer the prayer help us. Make we not take that same approach for our children, our family members we get special need. Because now the same God create all of them. So the next question now. Some people go say every fever na malaria. How we fit sabi for real? How we fit sabi? This person where they ask question. In get University of Pidgin. I just will not go enroll. So. Some people go say every fever na malaria. For real, how we fit sabi the difference without guessing? Okay, Dr. Gunta.
No be every fever be malaria because malaria na parasitic infection.
Okay.
The cause we na the parasite. We na female anopheles mosquito. They transmit come enter person body.
Okay.
So if person the female anopheles mosquito come bite person, they drop the malaria parasite for the body.
Okay.
And then the malaria parasite will just they grow, they expand,
Yes.
multiply for themselves. So they cause fever.
Fever.
So fever from malaria and malaria fever.
Okay.
But yes, several other things will they cause fever too. For instance, if you ingest any bacteria again another organism where they cause make person body sick. It will cause like typhoid fever or enteric fever.
Okay.
It come with body they hot.
Yes.
But no be from malaria.
Okay.
Person get meningitis.
Okay.
Body they hot. But no be from malaria.
And maybe typhoid itself. Urinary tract infection itself.
They cause fever, but no be from malaria.
Malaria.
So, no be every
Fever.
Be malaria. Now why we dey talk say we should go do
Test.
before you start to take
Any medicine.
But you get some accompanying symptoms. When some people, as then they get fever, their joints,
pain them.
they get bitter taste from mouth, get general body weakness. Then they go just talk, say, "Kai, this thing na malaria," because it's not ever happened to them before, and doctor give them.
They go just go buy that
So they
medicine.
just dey hold on to. Now, but get people again where they go get the fever, they go take the malaria. It was
You no go because you know they for that one.
So
Okay.
Fever be malaria.
Okay. My people, I think una here. Not be every fever be malaria. Fever they happen for different
Different
other
disease.
conditions where it no be malaria. Okay. So the next question now. Okay. If person mama or papa no get money to take carry pikin with ADHD go hospital, wetin dem fit do wey go still make sense medically? Dr. Bako.
Yeah, this one, Sha, a very dicey, very dicey one, because as a matter of fact, picking with ADHD really needs support. One, and the support they at different level at different class. The first one, let me say, the one where you should do for yourself, which is at the home level. Now, something you have to be really ready to know fully well that if not ADHD be this, waiting with the ADHD, what do you mean? If you get that understanding, then you will know how you go control and take care of your picking. So it has to first of all start from you. Yes. We know say money no d. After the one way you feel do by yourself, now that time we will drag how we want carry extend other. And organization like Beautiful Hands Foundation, we feel reach out to themselves. They will feel see how they feel help, extend at least care. We get one or two persons who will feel connect you with, we feel help you.
Yes.
So on this occasion, these are some of those places where we feel help. But else, the next thing primarily, just like Mr. Sam talked the other time, is to go to a hospital where they will see all of those symptoms, then at least try to see how they will diagnose you. Knowing fully well saying that we'll give a definition to this very particular thing. Then subsequently we'll now think of how, apart from what we do for our own house, then how maybe a special educator will come into play to see how to help this begin. But primarily, say you get ADHD, know that thing, waiting with that ADHD first. Then you, because the begin they more with you than any other person. So it will help you how to at least cope with that begin and see how to help some of those excesses, how to control. And so that you yourself no will get too tired and feel say, why this begin be like this? And some parents don't even understand the problem. They go start picking unnecessarily. Not knowing say the begin get a particular kind of problem. And now you that BTOT say one carry correct and more of abuse than correction. Because I didn't even get diagnosed, if you don't even think of carrying and hit that picking. Because there would have been modalities where you supposed to do. So you try to look out for all of those organizations, reach out to them, but yet first things first, we have to understand that this is the problem. But this is just how I think, I don't know, maybe another person get waiting and go out waiting I talk.
I want to add something. Make people understand, say, not every ADHD will require medication.
Maybe all. Majority less of medication self.
Say you don't get
Money.
Yes.
Hospital.
If you have the money to buy the card,
Is enough self.
Yes.
Because a behavioral rehabilitation, they more.
Now more of behavior issues.
Yeah.
Get that assessment first.
Now we will give them to suppress some of those hormones.
Can you afford that drugs?
Yes.
But the initial assessment, just basically that
Basic.
card where you just buy me, then assess you.
Okay.
Made a fear of say they will spend plenty money, they deprive them from going to the hospital.
Because as a matter of fact, no particular blood work where they will carry do diagnosis.
No.
Now interaction, so nobody will take your blood to go. You understand? So no fear at all.
I got some add something. In your mind.
Some of these things now they live inside.
Yeah.
I don't meet families. I don't meet plenty. In short, you get one boy while they work with that year. In body na so scars.
Yeah.
I go detect why you not they beat this boy.
Boy.
Then finally I can't push gradually. They can't go do assessment. This is an ADHD.
Yeah.
And the flogging begin calm down small. So because they don't understand why the boy no go even sit down doing assignments. You tell him make you do this one, he go begin gist you waiting no happen. He go bring something different topic. Then you no go even feel sit down one place like this. But like waiting Dr. Chukwuka talk, na behavioral interventions they work over time before they can relocate. The boy don't improve, go far.
Yeah.
No be say everything come together, but as the boy dey now, he dey independent.
Yeah.
You saw plenty things. You saw the family don't see plenty things when the boy if he carry in life do. So no be death sentence saying you can get ADHD.
At all.
You go hospital, they do the diagnosis. Hospitals nowadays, I like the fact that some doctors don't begin know some schools and centers where you feel go seek additional support.
Yes.
Then go refer you. You come, the school man will come do their own in-house
Assessment.
carry the pikin go school. Carry and go school. The school go do their own in-house assessment. Then the class where they go place and the teacher herself. Plenty schools now don't they do in-service training. Okay, for this particular condition, see the way you're not going to approach them and the rest. And you as the parents, see this program, but you be like you go put that account to.
I go put them. No, I go put them. I go put that account. I don't talk for second time. Maybe after the third time I go put them.
So you see that. Carry the pikin go school. Inside the school now, the school go collaborate. They go follow John waiting doctor tell you for hospital. The program where they go take fee support the child inside the school. ADHD, be condition where supposed to make you keep picking for her.
At all.
I want to make Dr. Gunta and Ogasam. I want to make explain executive function and why. Like you talk just now, say Pekin. If you understand why Pekin no go fit do your assignment. That one is executive function problem. So I want to make Dr. Gunta may start with the explanation of how the impairment, the problem where children with ADHD they get with their executive function, how they affect their ability to manage themselves and manage tasks and manage consistency compared to other children, including their brothers and sisters. Because it frustrates parents. It frustrates parents say, why this pikin it go do like this where when you say make you do this one. But if you say make you do this one now, you not go fit do one. You go be like say the pikin if they choose. You go start with the explanation, then you go follow through.
Even though Bako for answer.
Okay, the three of you. No problem. The three of you.
So, to answer and respond to this question, say, we supposed to understand, say, the different parts of the brain get different function.
Yes.
For instance, this executive function, now the frontal cortex.
Yes.
That one. And let me not say that the best, but to have executive function, now like higher center, higher function. Then maybe the parietal lobe, for instance. Now something where you will see, say, to be able to keep yourself, to let me say,
settled.
Yes.
Settled.
Yeah. You will see, say,
you coordinate it.
Button for sure.
Like
yeah.
the parietal.
They control that one.
That one. So for executive function, the frontal
Lobe.
Lobe, where they subserve executive function, and anything where they affect the frontal lobe will definitely affect executive
function.
So you will see, say yes, they get problem for certain things, but you will see, say if you tell and say meeting go dress up, him go put up wear fine shirt,
neat.
This one I saw their own. So it happens, and therefore, when we understand the strengths,
yes, and weakness,
we amplify the strengths and then reduce them. Now, Bako answer.
I don't give you the thing.
Just like the Chukwuka they talk about. As a matter of fact, the frontal lobe primarily, and they control our thinking, how to arrange something. They ask a question, how to at least make sense of the whole thing.
Yes.
With at least combination of circuitry from the parietal area, at least where they integrate the whole information. But this area of the brain, now they make us understand. So okay, then those see activities. So okay, I suppose go this place now by 10 o'clock. I go off. Okay, see what I'm supposed to arrange and everything. All now from here. You go school, come back. You're supposed to sit down for this seat. Then give you assignment. So if you come back house, you bath, you eat your food, you sit down, do your assignment. All the processing area now from this frontal lobe. So anything because now most of these behavioral problems are neurodevelopmental problems.
Right.
So apart from the behavioral aspects, because there's a problem
Maybe
already
the
up
frontal
there.
lobe.
Yes.
Okay.
So more of here. So the hormones, the dopamine, the acetylcholine,
serotonin
where they
and
release
all of that.
serotonin and the rest, where that them they sensitize and send the message for these people because the brain not develop well because of all of those few causes we've been talked that time. So you say most of these individuals now will get problem with coordination, even pay attention to class or even know say okay then tell you this and go do them. I got a couple of patients when at the group get a couple of funny persons say they will send you from point A to B because of distraction and some things. Before you reach there, you don't forget. You will come back. You will come back and so you will go back study work from the beginning to finish. So mostly because the brain not develop well, so problem they always so. But one sweet thing about the brain again, because especially for young people, they grow neuroplasticity and everything.
Neuroplasticity.
So if this person, the behavioral partner, if they coordinated,
Yes.
and all those repetitive things like the learning, you go make this person, all part of the brain, you go send function to other area. I say the person will pick up. If person gets stroke subsequently, if he can start work, maybe because of that very area, if you still go repeat brain imaging, you see that place they very dark. But you see the person work out normally.
So now neuroplasticity
Because
now.
it don't move function to a particular place. So now maybe the idea behind more of this physiotherapy or teaching person they do them repeatedly and everything can be tiring. So that the same concept for all of those special learning things. So
Okay,
maybe
sir.
Sam will add more.
By the time people like this talk,
You know how you to add Jonah. You don't go say what you take.
but like he talk, like both of them talk, is spot
Not
on.
on.
Now, you see this ADHD now, in don't talk as executive
Function,
Wetin
yes.
be executive
The functioning,
the ability
yes.
to take plan, okay, even your responses, how to
Yeah.
coordinate yourself. You know, say after this one, like what you want to do next with this. And you need all these things. For example, you need that for maths.
Yes.
Maths, sometimes maybe they say multiply 2-digit number. After you finish the first number, you go need move to the next
The
number.
number.
Then
How
you
you
go
want
need
one?
add them.
Yes.
But you see, sometimes they fit know the process, but
The structure.
move from one
One phase
operator
to the next.
Oh,
then
damn.
you go don lose
We
am.
don't lost.
They fit dey copy notes like this for board, then maybe they can't remember wetin they watch 2 weeks ago. They dey smile. Next thing they don skip like two
Two lines.
Maybe go find like the third line, continue the
Yeah.
notes like that. So the whole thing go dey
Disjointed, yes.
But amidst all of these things, therapy and support dey help.
Well, well.
Especially family support.
And
Well,
now,
well.
ADHD, I know say when they define, I will follow mention say na lifelong condition.
Not get medicine. No.
So e get some people over the years.
Mm.
In short, strategies dey wey dey follow help individuals with ADHD.
Yes.
So like to get planner, I know some adults wey dey live with ADHD. So dem dey always carry diary. If we get any discussion now, say okay by Saturday next week 3 o'clock we go meet, dem go need write am because if dem no write
That we
am,
go forget.
once they come out for there, they don't forget to. Sometimes they go fit sit down as we dey gist like this, then they take notes so that they go fit respond for way coordination dey small.
Yeah.
No be say you ask me question, I can't dey tell you as my neighbor dog lost. Then you can't dey ask me. Then after a while, maybe 30 minutes, say I don't dey talk. I come, so wetin
What will
be
be the
that
talk?
your
Yeah.
question? So you see, planning, and even as teachers, the pikin fit get your own timetable on top table. So you write say okay after this one you go do this one, after this one you go do this one. Then you go even put in break on top say you go get 5 minutes for here.
Yeah.
Do your
This one are for teachers now.
Yeah.
So visual
help-
schedule
it
for the
go help
pikin.
the pikin dey
To organize.
Yeah.
And-
it go help the coordination and you know this prompting when you talk. Prompting plain.
Na variation, yeah.
Broad. Physical
Na
prompt.
prompt there.
If you hold the child hand, gestural prompts. You know these say you dey give person
Side eye.
Na prompt. Oh.
Side eye.
Na prompt.
You
I
go-
dey warn you. Hey.
yes.
They go dey cut you that eye. Eh?
Non-verbal
You
cues, you
behave.
cannot do like this.
And e get wetin no be really new strategy for education, but shadowing.
Shadowing.
So, for instance, now pikin get hyperactivity or ADHD now. You get maybe shadow for the pikin, maybe a class assistant. The person sometimes no need do too much. Now, just to stand beside that pikin for the fact say person dey beside you, adults, you must say
You go arrange
try
himself.
coordinate.
even when you won't do anyhow, you don't see person, you go
You go calm
even,
down.
Preferential sitting in class. This kind of pikin, nothing concern am to dey back of class now.
No, it has to be in front. Where you go
He
this
go,
way.
in short, that no be front alone. No. If teacher table dey here, he go
He
dey
go beside the
beside,
teacher.
so that the teacher influence, the aura go dey.
Go make am calm down. Go dey make am calm down.
Then you go now empower them with words how to take express your needs. Just you get some children, when they don't tire to sit down, now then you go begin see all those behaviors wey you don't like. Maybe they go break pencil, they say they won't go sharpen them, or they go throw something for ground, or they go tear their book, or you know, funny things wey children sabi do to take escape walk or just try remove, or they go wan report person wey do something. So, but if they dey close to you and you tell them say, if you don't tire, just come meet me. Tell me say I don't tire. I need small break. And by the time the child notice say, even you come meet you say he need small break, you will give am. You see say need no go there for that behavior again. So if the child don't dey tire or he no understand what he want make him do, or he don't forget the instruction we give am, instead of make you begin to do anyhow, he go come ask you.
Yeah.
You no go distract others. Yeah. And once he ask you, you put am through, you feel continue. So
Yeah.
some of the little strategies where you feel add.
Now
to
do well.
support these individuals.
My people, I hope una dey enjoy this program. Me dey enjoy am, and I hope una dey learn. They say make I put account numbers. I dey think about that one. Okay. Make I put your own. Then you go give us percentage. No problem. Okay, Oga Boniface, this question now for you. They say if pikin no dey talk at 3 years old, you sure say na autism or if it be something else?
Okay, if pikin no dey talk at 3 years old, e get numerous complications wey dey follow. No be just autism. You know say autism na Oga Sam dey always talk. Say e dey get 3 ways wey e dey manifest or dey show itself.
Yes.
One na social interaction, communication and behavior. So you fit suspect autism, but you get some other conditions wey be say e dey affect early development of speech and language.
Yes.
You get some condition wey be say na we call am delayed development, delayed speech development. Wey be say the child suppose hit this particular milestone. Like what you ask now for age 3, you suppose they say something, suppose they say some number of words, sense together, they coordinate. They use the executive function as
They
do many things. But he know they do unlike him mate. If he be delayed development of speech. But if you want start to suspect autism, you guys check the other
Components.
dimensions
Yes.
of autism. That is the aspect of social interaction and behavior. If the child no get issues with social interaction and behavior, you don't get autism.
You don't get
So
autism.
you need go take and make they do
Assessments.
make they know whether which kind speech condition will the child get.
Okay.
Some people wey be say they disfluent.
Okay.
They get problems with their articulators. Wey be say if once they get problems with those articulators, it go dey difficult to speak. You get some wey be say they get auditory processing disorder. Wey be say wetin they hear, they know they too connect am with where the source of the sound. Yes.
Okay.
Some of them, as they hear sound, they know they too connect am with where the source. So if you hear cow, they shout. If you ask her, he go tell you say na goat. You understand? Some children like that they get
Auditory processing disorder. Okay.
So you go gas check all these things, make you know say okay, no be say you go label the child immediately say na autism. No.
Okay.
But you get so many complications.
So at the end of the day, go hospital
Hospital.
for assessments. Okay. Another question again for Oga Boniface. It says since speech therapy they cost and no plenty therapists they Naija, what you go advise low income parents make them do when their pikin need speech therapy support?
This question come make me the suspect Boniface. That's the guy get plenty money. In they hide out. In they hide out. They disguise.
This challenge, this one na general challenge for every field.
Every field.
Like the question we answer earlier, we be say I know to get money.
Yes.
Go hospital.
Yes. Yes.
We get some few things like we discussed our last discussion last week. We give una tips. I be we no give. So, but you get some things where you fit do for house to help your child. You understand? Maybe say as you dey do and you dey plan also make speech therapist come with your own intervention. But generally, that child needs intervention. That child needs a speech therapy. You need a professional who say go help you. Even you, the parents, now go teach you one or two things where you go they do.
Yes.
For house, because now you they stay with the child most of the time.
Yes.
Therapists will go maybe highest 1 hour, 2 hours highest. You understand? Spend with the child. But now you maybe say they stay a long time. So you get some things where we say the speech therapist will advise you see this thing according depending on the condition. Then you say see what you supposed to.
Oga, Dr. Bako,
Yes,
this question come, although we never talk about them, but I feel it's a very important question. Is it make we address smoking, especially for men?
Yeah, smoking, especially for men. Generally, smoking are one of those addictive behaviors, where they very, very common for our environment. In as much as men are then they very obvious, they do them. That's also women they follow smoke. The problem with smoking they affect our blood vessels. Especially most of those individuals, they come with heart problem, they come with stroke, and another major component the lungs, because they are mostly they first enter before you even enter the blood system.
Yes.
Because from the tar way they take and some of those chemical components where they inside, what they do is they cause what they call atherosclerosis. They affect the blood vessel, they make them more stiff. And with these small injuries, what thing they happen say somehow maybe some clots will form for those small blood vessels. When those clots form, either from fat or normal blood, because those blood vessels already get problem because of this cigar we smoke. Somehow, if then dislodge, because our blood, our heart's in the pump, if then dislodge go through your heart, for starters, you don't get heart attack with that. Then dislodge go through your brain, you don't get stroke, which is brain attack. Because first things first, even as you don't get atherosclerosis, because the lumen of the blood vessel now don't this small. We down at Nadia Kunta, them the vascular people well.
Okay.
The lumen of that blood vessel, we call that atherosclerosis, really this small. So automatically the heart have to pump against resistance because of that cigar they smoke. We don't affect your blood vessel. You got on this stiff, you got on this small. So the heart have to pump against resistance. So that resistance when they pump against, it gas go force. So imagine say you had a BP force. You then go check your BP, what thing they go see.
Go high.
Why? From
Smoking.
so those ones are the lifestyle thing where we feel change, we feel adjust. Especially when we talk about stroke or heart problem and everything. Those are modifiable risk factors. So smoking at any point, maybe the right thing, and they among the top risk factors for lung cancer. And lung cancer they much more common in men. So smoking as a lifestyle, it's not a thing that we advise. Most times people they alcohol, cigarette, all now things we don't like. But if you keep cigar and alcohol, so we go test and reduce alcohol, but stop smoking. But both of them no one would like. But because the smoking get much more crazy effect, and just like because they touch all the blood vessels, and for our heart to pump the same blood, now blood vessels they use to every part of our body. So imagine say all of them they are affected.
So you not the blood, not dead body, but
no, you are walking corpse. Not just time, not just time.
Okay, and which means say as this smoking can't be so now, not be waiting woman go they smoke when you get now.
Any human being say, no one may smoke.
And we talk alcohol that day. This smoking was past alcohol
no,
for
smoking was
pregnancy.
Bad.
In addition to what you don't talk, smoking they cause abnormalities for chromosomes. Yes. So once your chromosomes or your genes don't they distorted because of the tar where they
enter.
If you grow up, you will get disability.
Yes.
That's one. Secondly, as you they smoke now you they smoke, but you they smoke for house. Your wife know they smoke.
Second-hand
She a
people.
secondary
Smoker.
So she they pregnant. She might
go there affect.
the consequences. So we advise.
You stop totally.
And as those people which they breathe, we go affect the pikin chromosome too.
Directly. So mutation will happen.
Mutation will happen.
You fit born pikin because of we get genetic abnormality because you smoke.
And your wife they inhale am.
So both of them na smoke.
Okay.
You see why it tire me as I go study special education. Because at the point I don't want to get pikin. Anything be
Everywhere.
And the risk factors they everywhere for our environment. They everywhere.
Ogasa,
Yes.
This question.
Okay.
Okay. Augusta,
Yes,
this
sir.
one are for you. You say, woman, when your husband gets ADHD, what will be your advice, Sam? How you go fit take support the husband?
This one a very practical question, and I like it.
Okay.
I like it. Now, make us start with this small yarn. Nobody feels this love. And you feel get through too. But if you use the truth flog person, the person go resist that.
Okay. Say 5 minutes.
If you use truth flog person, the person go resist that truth. So now, first things first, now to follow and jejely. You let them, especially if when I don't do diagnosis,
ADHD gets
different strategies they will help them. Even get issues with executive function,
Training.
you forget things, you go get appointment, you don't go, they mix up things, maybe official stuff, you spoil, you go need planner. These are very small things, and now you don't even need writer. Applications there for food now. We if they plan your events, your schedule, and if you can add alarm to each of those things, it will help you. You get course where I take on ADHD. The woman say, in short, her own at the high side, say she don't on medication steady, and on top the medication, she dey waka with planner steadily. Then person come just me say for just now he meet one man inside public transport. Say the man now autistic man, but he gets application for a phone. Even the how much he go give, how much change conductor go give him, everything. And now say she understand autism, then she can't sit close to them. Now she feel piece these things together. Just this one don't learn coping mechanism, and he no will get problem. So with that your husband now, it could be as easy as, okay, how will fit help you? Make una brainstorm.
Yes.
Download apps, buy diary or planner. They plan in events, making life get small coordination again. You go follow help improve that executive function.
And love go make sense.
Yes.
Love go make sense. Dr. Bako. No problem. Okay. The other question be say, Agbo. Malaria.
Agbo don't come again.
Is it can Agbo fit serve as antibiotics and some malaria attack no dey gree for antibiotics?
Ma talk small, maybe couldn't have go add. As a matter of fact, we dey try see how herbal medication, how we bring them into normal, but there have to be processes. Because the problem with Agbo, we never check the active ingredient and keep them side by side by waiting the body feel contain. That's because every drug we take today, be it paracetamol, be it any antibiotic, there's a recommended daily allowance for anything they take. Because else, if you think they too much, it will cause you problem for your liver. Because most drugs they take that through the liver, they first go before you think of going anywhere. Because the liver first understands this way, if your antibody system a problem, it will cause or not. If that, it will be like poison, it will detoxify him. And in the event of the detoxification, he might get injury.
Yes.
Because maybe the byproduct of that detoxification will be another chemical if it cause a problem.
Yes.
Now, makes some people, when they take all of those Agbo, get liver problem or kidney problem.
Okay.
So, best is, for now in Nigeria, you have to go through the right route. If you think, say, maybe you get Agbo waiting, say they have for a particular thing, go NAFDAC or at least work with one pharmaceutical company. May they extract that active ingredient for that your Agbo way things they go help for malaria. Then they go do them as a big major study, and then subsequently present NAFDAC consiam. Then see say anything they work. And this one will be like one thing you go do within 1 year. And I think so they take long process. I think the only vaccine they don't use they very short that be COVID for the whole of this world.
I'm telling you.
That else before you produce one drug and you enter into mainstream 3, 5, 10 years before one drug enter mainstream. So if you want me Agbo enter the way with that, but else medically us we still we didn't look there with corner eye. We don't really want her like that.
Finish. Okay, Dr. Bako, this question is still for you too. He said this autism now only for belle or for small age person fit develop I be person fit come up with this condition for old age? If it happen for old age, what if it cause am?
Okay, most times it is possible to happen for old age. And the basic thing we say, if something touch inside the brain, like now one of those sweet things we may have to do now, stroke. You understand? Depending on the area of the brain we are affected, like just as we just finished talking about development, executive area, the frontal lobe. So if you get stroke for all of those things, you primarily manage our behavior. You see, say to even do other things subsequently, even if you happen, funny enough, the stroke now they happen even amongst 30-something years and everything. It don't they come on now. And basically, because if it happen like that, and which painfully again, the one where they happen amongst young people again, now the most dangerous one, which is the hemorrhagic type of stroke, where now blood vessel for inside some of the brain they burst.
And what did they cause am?
Either we get to they call aneurysm, maybe our blood vessels swell up one kind, we don't know, because they say about almost 17 to about almost 20-something% of us for this world get to they call brain aneurysm. Somehow our blood vessel just dilate abnormally, and that dilatation they create area of weakness. Where we say even you mustn't be hypertensive, say maybe they do one major activity safe. You will increase your blood pressure at that particular time, and that very weak area if you just burst. And with that, you don't get stroke with that. And that hemorrhagic stroke, now him be the most complex one. Majority of people dies. I'm sorry for Kunta for his last experience anyway. He experienced one that is very, very painful because he's a friend that we know. So most young people see that hemorrhagic stroke. Now him they much more common. So imagine where the part of the brain where that thing happen. So I'm just using this stroke for example now. So if those problem happen, because last time the neurodevelopmental problem now, poor oxygenation to the brain and everything, and stroke now the major thing. Similarly, even at elderly age, people abnormal this thing to the brain say when we cause you movement disorder, even when you just like people who get cerebral palsy. If you get stroke, we affect the area of one particular part of the brain they call basal ganglia. You see a person, he might go just turn like person who get cerebral palsy. So anything will cause deoxygenation even at your old age if it happen. Some people get genetic things where most times they present at old age, but more often than not around that kind of 40, 55 years, now they come on, but it is possible. Especially for medicine self, there is nothing that is impossible for medicine. Everything is possible. Okay. So now the basic truth with that.
So sometimes like we understand, say if we say person get am, but
yes, that
they don't identify from childhood now. Old age the thing go manifest. So sometimes people have it, but they don't even know.
And some kind of stressful events. Now if you just push them, it will become full blown. Maybe one, okay, let's say this person get time in the managing thing, then he can lose one very loved one. You can't say some of their behavior will just switch ways. You can't say this thing where this person gets one, but now the thing they much more florid. So most significant events, if you make these people they subtle, subsequently become very full blown at when they don't become adults.
Okay, between Dr. Guntab and Dr. Bako, a physical hitting of woman where get belle, if you impact the child now,
Certainly.
and if you result to any of these conditions, how?
So woman will get belle, and then they abuse her. So you can cause physical trauma to the, not just to her,
To the begin to.
Really?
Now, there's what we call the placenta. When there, the baby they get
Food and oxygen, everything are from there.
So any trauma, anything we go dislodge the
Placenta.
Will affect the
will
picking.
affect nutritional supply to the brain. So it will cause
Problem for the picking.
Yeah. So in fact, you get some people we tell say they get placenta brochure or placenta
previa.
The placenta no day where it's supposed to.
Supposedly.
Yes, that one they affect. We're not talk of
Let's say trauma.
abusing her and then causing some injury. Or as you they hit her, if you be say you they hit
Directly on the picking.
baby's head.
At the baby's head.
Why you go sit down here say picking the kick safe. So there's high tendency during one of those kicks safe if you hit the head.
So if you be saying that directly, they hit the head.
Direct trauma.
Small traumas good. Or even if you know hit her, it just the brain is supposed to get cushion. And why they had so you get some fluid where they cushion as you they hit her, they
This one go move. Hit
so
this.
boxers you get micro
Injuries.
So as they hit her, even if you don't hit the baby they hit bo. So they get small injuries like boxers.
You know, so ordinarily to act within the talk, ordinarily say Why it say if woman comes say she dey pregnant, one of the histories where the gynecologist or the obstetrician go ask, go say whether this pregnancy now wants pregnancy or she planned pregnancy or unplanned. Because one, the outcome still depend whether it dey planned or unplanned. Because now, if it dey unplanned, maybe the more because I can remember as a house officer, then one mama cry for inside hospital. She dey pregnant, her daughter dey pregnant.
Yeah.
So she say she can't even take it. Say she don't even know how she'll go back house, go sit down, say she get pikin, how with her pikin, they carry belly, they carry waka. You understand? So you see this kind of, so you know, say this kind of one, if they don't put eye, the outcome of that pregnancy will be bad. So imagine then talk less of hitting. Psychologically for the mother, say it will affect the pregnancy. Then talk less of somebody they abuse the pikin. So na practical thing with that.
When I hear my people, make una not hit una wife when they get belly. When I not hit woman wey get belly because it dey affect the pikin for inside belly. Maybe we dey careful when we dey relate with pregnant women. And pregnant women too, men na too mona protect on herself. If una dey around people where you be say they abusive, mona make effort as una go fit take carry on herself come up for that environment because even if you and the pikin papa una don't live una life reach where una fit put in for belly, in just dey come in own. Una actions fit give the poor pikin condition when you go come to suffer for the rest of your life. Why? Because God take this pikin, bless una carry una wahala, give the pikin. So not be only una anger, I be waiting una think say be una problem. Una go to think about when una now they try to give birth to pikin. Now that pikin na be priority. Once una don't decide to be papa and mama, now na pikin na be priority at all stages. So my people, we don't use time well, not be small. So now only one question. Now we'll go fit add. Join this one now before we go say bye-bye. Make ourselves still get chance to do other things. So the last question now be say, okay, Oga Bako don't answer the Agbo question. Say, may they go through NAFDAC first to make sure say the Agbo is clean. Then this question I want to talk about. Say some people say autism na spiritual attack or village people hard work. Make all of us contribute to this one. We'll go start. So after this contribution, we go say bye-bye.
I know they even talk plenty for this one. Autism no be village people condition. No be village people send them. So if they want send condition, they no go know autism to send. Now condition we result as a result of different wiring of the brain, where they affect communication, social interaction, and behavior. I will end up for that.
So na simple one now. Just as Sam talk, this one I just like we just do build up ni. Because as a matter of fact, autism has nothing to do with maybe spiritual problem or anything. At least we've talked about the causes, then plenty. To the level of even genetic causes follow there. Imagine anything with the genetic, it is very difficult to manage. So it has nothing to do with say maybe people for village or witchcraft or anything. And something we got to do with our brain development and also our environmental behavioral development. So we won't put spiritual because whenever they push blame to the spirits or push blame to jazz or any other thing, I make we no go feel look inward to take care of this individual. So it has nothing to do with that. We go try to say person will get autism will help take care of them. Thank you.
Well, if you talk say na spirit, it means say you been dey drink spirit.
Now him with the spirit. Yes, go get picking go get autism.
Problem.
In that regard,
That's spiritual.
but there's this scientific basis for autism. We can explain it from scientific.
Yes.
And any disease we get scientific basis will be spiritual.
At all.
I know people will think, you go hospital, they go check you, then do these things, you know,
They don't see
you don't see anything, they go talk, say, nah, spiritual.
Na village
But again, even the level of understanding and identifying diseases, they dependent on the available resources
Yeah.
with the hospital. So
Yeah.
many diseases when we talk in as spiritual, no be
Spiritual.
spiritual. But for autism, it is scientifically proven, and there's scientific basis for it, explanation for it, and there are scientific interventions that can be given to it. So no be spiritual.
So everybody, they don't play ground. You see, I can't notice if people they hold on to say na spirit na from village they send them. They say they never come to the point of acceptance.
Yes.
Never come to accept that condition.
Yes.
Often you will see many people they go to church. They say there are village people they pursue me this and that. Like waiting son talk. He say your village people don't know autism. So they don't go fit send you autism. That one hits me. So
They don't know autism.
if you still the thing say na village people they pursue you, mean say you still the bargain.
Mm.
You still the bargain, you still the trust say you get some kind of treatment where we say you go give to handle this thing. And we don't tell you say these conditions now management they go learn coping mechanisms, come they help themselves. As they help themselves, you know go even Google notice say they get autism until maybe you be specialist or you don't know one or two. But you see, now waiting we go need to understand. So maybe we come to the point where we say we go accept our children the way they are. And that point where we say you go even help doctor them, therapists, everybody will join put mouth for this matter, you go help them and their work will
They go easy. I beg make una no verse. Now one, this is not the last one. Only this
last one.
And this one, I go ask this last question because now man question. It concern papa matter stroke husband. So the question now be say, okay, first of all, what will be the role of husband and papa to make sure say to prevent this kind of condition to happen for pikin life? Then if it can't still happen after you don't try, what will be still the role of papa stroke husband to in terms of support for the family because of the pikin condition? Everybody like this question. We go start with Dr. Gita.
First, you're supposed to understand, say, papa, your as papa start with P, your role now protection.
Now protection.
Protect the family. And that protection will be just to go carry gun, stand for door. Now to provide the enabling environment, the support systems where your house and your household will take with. So to start with, one, you go insist say nutritional support. They okay. So you have to provide
Food.
for the family. That's one. Two, you must be able to provide resources because if woman get they pregnant, sometimes you go see woman go antenatal, but
No money.
no day. But at least now some governments they bring policies where we help pregnant women. So as papa, you supposed to ensure say my wife you get pregnant, you go hospital, go do antenatal. We will give you medications where you supposed take. And you supposed to understand say as woman they pregnant, she they like egg. So you suppose they give her TLC, tender loving care.
I think that they hear. I mean, we talk about what I want to say. They do women's rights. Now men they talk and so make una they hear.
So that she no be servant, no be machine wey go dey work up and down.
Up and down.
The woman dey pregnant, you suppose support.
Yes.
No be weakness, make man may see you.
Attire.
At all.
You do well.
The TLC.
The part of the TLC.
Then you suppose ensure say delivery may she do am for hospital.
For hospital.
No Hebrew woman. My grandparents or my grandmother.
No, Baba, no Hebrew Baba. Go hospital.
If you do that one, then you don't show level of
Responsibility.
Say, yes, you will take care of. And if you do one, you may be fortunate, make you maybe say the birth process will just be
They
seamless. And maybe you may be fortunate, say nothing will happen. And
God
will
test
not
you
save
with this
yourself.
one.
It's
Mm.
highly
So
likely.
that 9 months of intense care,
Mm.
the TLC will save you several years
Serious.
Of stress.
of stress.
Yeah.
Oh, so yeah.
Yeah, that's the
Okay,
truth.
what about if after yes you do all this one as you talk so
Because at the next one, I want to go with that. I want to
Yes.
now talk about the most important part, which is the prevention.
the prevention.
You understand? Now, if you don't come get
If you
am,
don't come get
you
am.
understand? It's still no shift on the fact, say, now you still be the head.
Mm.
You know, see, because you have to be around. Because most times, traditionally, now women, they suffer when it comes to matter like this.
Women too, they
But it's
suffer.
high time for the men to understand that the care of a child, or say the beginning today get autism or ADHD or maybe one neurodevelopmental problem, either due to malaria or cerebral palsy.
see.
Now the combo of mama and papa somehow get this speaking. Now 12 when I get this speaking.
Yes.
So if this speaking get one of those disabilities, now both of them are supposed to sit down. When I go sit down, arrange you and waka. Depend years when I get 2 different work. I don't see home where we say, depending on the work where the man go to say, okay, him go stay house, take care of this children. Maybe the woman they go work. Okay, just imagine say, as I did now, Dr. Bako, I dey work 100K. My wife money na 300K. Then I'll tell her she resign. Ma carry 100K do it. Babe, go, I go handle this thing first. As I tell you with all pride, I'm not going to shame for anything. Sef. I go say me, I go dey stay at home. Moku see say these children good. Maybe their fault say them come like this. As they don't come now, we have to take this stand. And you as the father, have to be the person where we say go sit down, define this thing for house. We can't run away and allow these women suffer. That means say these women always see as they depressed. Like you go sing come say you want constant disturbance, the Oza room and other things,
Yes.
and you expect say make she dey elated after not only her they suffer that suffer. So the men are supposed to be a partner in this. You are supposed to at least see to it that your wife is happy. If you come back from work, maybe say now you dey go to work. If you come back to say, honey, maybe you just get 1 30-minute nap.
Yes.
Honey, go sleep.
Yes.
Let me go handle this one now from here.
Yeah.
I'm together with this child. We'll continue. We'll go play ball. Even if you don't choose to play ball, man, the M stone. We'll go there together and you go find somewhere rest. So it's supposed to be something that we have to sit down as a family and as a father. Now you supposed to coordinate all of this. You
Yeah.
can't leave this. I know women, they are resilient. We thought we tell you they will try handle them, but no be so it's supposed to be.
No be so it's
Because when you
supposed
come
to
be say leave am for, it can't be like punishment. Like say and she directly born them, so maybe she you're not supposed to be like. So just as one that from the preventive state, even when it happens, say you can't get picking like that. Now still 12 now provision, take her to the hospital, especially Educator, hospital diagnosis, everything we don't be talk about. You are supposed to be the head to coordinate all of this to the level of even taking care of the child at home.
God bless you now. Acceptance.
Moment the papa accept.
Say, see you, Abba.
You don't suffer.
You don't solve Abba. Abba.
You don't suffer. Because children, the way they look at papa, will be small. So once they comfortable and you say, Papa, I get this challenge, my papa don't accept me. You know they see me as shame, you know they
Abba.
don't suffer.
That too go help the
You don't-
pikin.
you don't
The
suffer.
siblings go understand because the papa don't solve problems. So even the siblings go like the begin.
Papa, if na
Yes.
only mama issue, now only mama they try to no problem dey.
Problem
dey.
dey.
Psychologically, no.
The other siblings say go understand.
50% of the problems happen.
And the acceptance wey we dey talk of papa no be say mouth acceptance or
Mm.
action like
You have to
talk
be active in
action
the whole
acceptance
process.
and no be say I know say God go help us and you sit down for where you sit down. No, as Dr. Bako talk, you go move,
You have to
you go
do
discuss with your wife, una go dey find solution. Okay, we get 2 teachers for the house. Oh yeah, I'm gonna contribute now.
We still put mouth for this one.
Una go put una go put mouth.
Since na men name be call for this one.
You not be man. You not be man.
What I want to say, for my own practice,
That one now I want
wetin
here.
I don discover be say any pikin wey be say the papa and the mama dey involved for their development, their care,
Abba.
e dey always dey different.
See the outcome they good.
Once the papa follow dey involved, in short, decision making go dey like this.
Fast, fast.
Sometimes you go make recommendation. The mama will say, make I talk to my husband.
Yes,
You
most
sef
times
go
like
know
that.
say the mama dey tiptoe around the topic because he say, how this is what they talk. My husband no even dey look at it. If him pikin dey alright. So even decision making you go slow. Everything go
Slow.
Sometimes, okay, for these our clients, most times resources na from papa dey come. Some papa you go give recommendation, do this, they go tell you say, Kai, they know they get that kind of money to spend for that kind of thing. But they go they spend for
Other
other
things.
things.
Other
Other
children.
things.
Yeah.
So the difference is always dey clear. Once the papa hand dey inside and he hold the mama hand, the two of them, the pikin they improve
Fast.
and they feel arrest the situation much earlier. So men. Now work they cut out for now. Abi our work they
Nah,
cut out
our.
for us. They cut out for us. Yeah.
Oga Boniface.
Okay, Oga Sam don't talk everything. Don't talk everything because even for my practice, I don't notice that. See, once parents, once the two parties, both the father and the mother, they involved. The difference the day. You go see, in fact, for my work, they easy
For you.
to do the work and they appreciate and well. You understand? And as you they support me with the therapist with your appreciation and I see how you they follow the thing, they help me too.
Yeah.
And they put all my
Effort,
yeah.
But when I see saying on one side, the thing will they do me one kind. Before you know, they will say, Kai, we won't stop this, make we could stop it because
No result.
Papa know the support. But if Papa and Mama join force together, they different. And one thing I want chook mouth for the preventive because I get one word where our doctor talk and where the thing strike me. Especially for the stage of delivery. You get some parents will be say they experience complications during delivery. And unto say they believe say they be Hebrew women. They want push her and doctor won't talk say, madam, this thing a serious issue. Madam, wait, we go do you serious. They will say no. Now Hebrew women they be and they must push. Me, I know they mock am because true. If you they claim some things by faith, it will happen to you. Now waiting with the teach, you understand for our churches. But the thing they say once they don't tell you say complications don't they set your mind. Agree say okay, make I follow the doctor. Now doctor now person way no road we dey follow. So since doctor don't tell you say madam, this case you know if you push am, madam we dey take you go.
Yes.
Agree with the doctor. That kind of situation they help reduce all these risks.
Seriously.
So we say we no suppose get. So now just what I want check.
Okay, my people, we don't try for free. We not put account number. When our two don't try, when I sit down, they listen to her because if we are not listening to her, we don't get where we go put account number in the first place. So we dey help each other. When I do well today, I hope say this time when I sit down with us, when I really gain. Because me where I did here, I go school, now they book and borrow now I know who. But they inside here, by God's grace. When I do well, say when I stay with us to this time. My guests and my brothers. Now when I get luck today, now 4 men, I ain't just sit down. Today they give this kind of free information. God bless all of you now. Now do it. So when I tell our audience,
My people,
bye bye.
Thank you. Today in a long ride now. Very informative.
Yes.
We hope so. Now we apply them. Then as we don't teach one now, you self teach person.
Teach person, yes. Tell person, guide person, help person.
Every picking they unique.
Yeah.
No, they carry person picking, they always drag compare our own.
Yeah.
As our own deal like that, more try manage them. No matter the problems, so they get more still try manage them. Let's go to the right place when they diagnose this picking. The problem they will not say we get places so if you at least point to,
Yes.
they will help us. Now, well done for staying with us. Thank you.
Thank you. Say when I don't stay rich this time. Who could remember say problem no dey finish. So I don't really give person problem.
We no
go
go
fear
fit
and
do.
Anything we God give you, accept them with 2 hands. Our hands are beautiful and we can do beautiful things with
Yes.
our hands. So let us continue to persevere. We continue to do better things, and as we continue, the world generally will be better for everybody.
Okay, my people, I want to greet you now when I do well to stay with us up to this time. You see, like meeting of God, San talk, we don't be na long ride. Check the time now, na long ride. They tell you. But waiting I want to talk, we say, you see, you get one thing I don't notice. Say, anytime we problem, God, they also create solution.
Yes.
They create, maybe say something, maybe say it will help ameliorate or solve that particular problem. So make una no give up. like this now where you don't know about this thing, talk to another person. Maybe say the suspect say that child get issue. That get that child will get issue. Talk to them. Maybe they listen to us. Maybe they go over our videos.
Yes.
Check us. And you go see say you will help person just by sharing that information. So my people, I agree to now plenty.
Okay, oh, my people. This now Mrs. Modupe Afiz Ogun. Una do well, oh. Make una ask Dr. Bako talk, Dr. Guntap talk, Oga Sam talk, Oga Boniface talk. Make una all this one una don't hear today. Make una tell another person. Make una share the links. Make una encourage others. May they come join. May they come hear. Because what you know, you go fear am. And what you dey fear, you want to wear. And that one not be solution for everybody. But when you know, it will give you rest of mind. Say, okay, this one a problem, but now what person go fit work with, because solution there. Cure fit not there, but we go fit manager. And even those of us, as I talked before, we will say we complete. Nobody complete for here. Everybody they manage. If your head not pain you today, your leg will pain you tomorrow. Now say everybody they carry everybody waka small. So my people, now do well. God bless you now. We go see next week Saturday. Now bye bye.